I think there are two key highlights for me from ESMO this year. The first was hearing the presentation of the TOPGEAR trial. So the TOPGEAR trial was an international multi-center trial undertaken across multiple different countries and different continents, so has really strong external validity and generalizability to practice. And what TOPGEAR looked at was whether the addition of radiotherapy to standard chemotherapy in patients undergoing surgery for gastric and gastroesophageal junction adenocarcinoma was associated with improved short and long-term outcomes. And what TOPGEAR showed was that even though the pathologic outcomes were better in the group who received radiotherapy in addition to chemotherapy before surgery, this didn't translate into any difference in long-term survival outcomes. And this is consistent with data from the Neo-Aegis trial and the ESOPEC trial. The Neo-Aegis trial, which we ran at St. James's Hospital, was an international multi-center trial that looked at chemoradiotherapy versus chemotherapy with slightly different protocols in the perioperative or preoperative treatment of patients with esophageal and junctional adenocarcinoma. So a slightly different question, but the two trials have very consistent results, and as does the ESOPEC trial, which was recently presented at ASCO, and we're awaiting full publication of that trial, which will hopefully come out soon. So that's one key highlight. And the other really big highlight for me was being able to experience the patient advocacy track here at ESMO this year. So there are a lot of patient participants and also carers and advocates taking part in a parallel advocacy track at the ESMO Congress. This is really important, helping to involve patients, carers and advocates in the research that we're doing. And it's really great to see such a strong advocacy track here at ESMO. And I hope that's something we can bring to more surgical congresses in the future.